Good afternoon, everyone. We will begin shortly as people come into the room here. So we'll just watch the numbers of attendees stabilize, and then we'll begin our program. Okay. Can you see the, Mary Lou, can you see the nice little number of participants, and it just kind of is turning over? And so,
yes. Oh, wow.
Welcome, everyone. So we do like starting on time, but it does take a few minutes to get everyone in, and especially apologies over the confusion as to what time this is. It's actually 10:30 in the morning that we do our health conversations. At first, we were going to do them on a quarterly basis, and well, 2020 is a different kind of year, so we've been doing them a little bit more often. And I can see the numbers of participants are still coming in, so we'll just hold on for another couple of minutes. And then by the time I do all the prelims, it'll be a few more minutes after that, because there's lots of prelims that we like to do here. So first and foremost, I want to acknowledge that we are gathered, at least here in this part of New South Wales and this part of Sydney, on the Gadigal clan of the Eora Nation, the original inhabitants of this land who never ceded their sovereignty over it. And we acknowledge their leaders, past, present, and emerging, and pledge to work with them for the fulfillment of the Uluru Statement of the Heart and other matters that will bring justice. We'll talk about that more at the end of today, just a little announcement of activities for next week. But before that, I want to turn it over to what today is all about. And again, apologies over the confusion of start time, 10:30 in the morning. We'd like to do our health conversations, give you time to start a Sunday morning a little bit more slowly. And this was planned about a month ago. I think Marina and Mary Lou had their first conversation about this. And it was going to be and it still will be, part of the conversation, the notion that we are talking about life interrupted, balancing COVID-19 risks with the fulfillment of the fullness of living. And we welcome back Professor Mary-Louise McLaws, and she's a member of the World Health Organization Health Emergencies Program Experts Advisory Panel for Infection Prevention and Control, Preparedness, Readiness, and Response to COVID-19. But more than that, she's a professor of epidemiology at Hospital for Infections and Infectious Diseases Control. She's traveled around the world dealing with this, and lately she has become a person who is often being quoted in the press, interviewed on video, on media, and a leading commentator on the issues of what we are doing right now to face the crisis of COVID. And of course, a month ago when we first talked about this, we were imagining that transitioning out into a new era, and unfortunately, it isn't quite that way. I want to just thank you, Mary Lou, for being with us again this morning, for being a longstanding member of Emanuel Synagogue, for having such a beautiful family, each of you giving intelligently to the world. And really, I thank you for such generous giving of your time, always to make yourself available and educate the public about the crisis in front of us. So I'll turn it over to you to present a little bit of a background to the world. And of course, I know you'll drill down into what's going on here in Melbourne and in Victoria and the challenges that now places in front of us. Thanks for being here.
Thank you. Thank you, Rabbi Cavans. Good morning, and thank you for joining us. Please, if there's any questions, please write them in the Q&A, and Rabbi will interrupt me, and I'll answer them rather than wait to the end if there's something you want me to talk about straight away. So let me show you how IT savvy I am, and I'm going to go into my slides for you, and just let me know if you can't see them. How's that, Rabbi? Can you see that?
I'm good.
Excellent. Okay. So what I thought I'd do is give you a little overview of how the rest of the world is going, and then how we're doing, particularly in New South Wales and then in Melbourne, where people are worried. So, sadly, we are still topping the charts, close to 10 million people. I've also, you can have these slides. I've given you the links where I've gone to. So this is a WHO link, and it gives you daily updates. The WHO compile the numbers of cases by region. So the different colors, the lighter colors, suggest a lower number of cases in the last 7 days. The one thing you do need to be very careful about when you look at these figures and illustrations is many of these countries, particularly, sadly you can't see my pointer, but I'm pointing to Brazil and South Americas, Africa, and some parts of Southeast Asia. They don't have a very extensive surveillance, so it's very difficult to rely on some of the numbers, particularly in Africa. Of course, Brazil, we know, is out of control and will soon overtake America with its numbers. But this just gives you a view of how we're seeing this. And we in the Southern Hemisphere shouldn't be too pleased with ourselves, because this is a global effort. If we lift our borders, we will find ourselves in a similar predicament as the United States and other countries, where they're now finding that they want to support their economy at the expense of trying to work towards zero, or at least some sort of reasonable containment. WHO have also put it into a figure. So these are by region. So WHO has several regions. We live in the Wipro region, and right down the bottom, that tiny little yellow-orange level is us and many of our neighbors down the bottom. But as you can see, the Americas are sadly leading the way. If you go to another page, bio regions, you can see that our Western Pacific region includes China, Singapore, Philippines, Japan, etc. And if you just look at the number of confirmed cases, the second column from the left, you'll see that, of course, China led the way at 85,000 cases to date. People have been talking about being very concerned about China, having recently 158 cases, mainly in being imported around the country from travelers within the country and travelers from outside the country. They've effectively, in 9 days, tested 6.5 million people in Wuhan, and Hubei, to find cases and put them into quarantine. And I was asked last night by Turkey how India was going, and India is planning to test 29 million people. New Delhi is the second largest city in India, and they have an uncontrolled outbreak with topping of thousands per day being identified, but that's a severe underestimation. We think we're doing fairly well, but the better way of looking at this is infections per million. And this one doesn't give this, it just gives the raw numbers. So we go to another site called the Worldometer, and I think that this is one of the best sites I've seen for kind of geospatial epidemiological mapping. And the Johns Hopkins, which I showed you last time, is still going, but sadly it doesn't include important indices such as numbers of serious and critical, and the cases per million. So on the left-hand side, you've got the US topping nearly 6 million cases. Brazil, Russia, and India are leading the leaderboard. We've now surpassed 10 million cases around the world. So if you look further towards the right-hand side of this table, you'll get total cases and new cases each day. There are new cases for the 24-hour period, deaths and new deaths in the 24-hour period, those that are recovered. So you have to minus the total recovered from the total cases to give the next column active cases. And that gives you an idea of how difficult it is for countries to control the spread. So the US has 1.388 million active cases across its 52 states. So it has an enormous challenge ahead of it. I was asked the other day my opinion of how the US was going. I think I must have been a little tired that evening. I said that the epidemiology of the US was looking more like 52 countries rather than 52 states. Normally I'm a little more diplomatic than that, and then did suggest that US used to be a global leader in lots of different areas, and particularly in disease control. They were the group, and I've done some training in the US, they lead the way in epidemiology, but sadly their government and their 52 independent governments are not coming together as a cohesive group like our government has, and they're all doing their own thing. And they've even made mask use into a political football. Now in New York City, their state and their New York State, New York City are very populated, densely populated, and CDC has called for everybody to wear a cloth mask as one method of being able to try to contain the disease. But of course the other one is testing. And as I mentioned, fourth down on that leader board is India, where it's now going to try to test 29 million citizens in New Delhi. And I think they'll probably take at least 30 days to do that. But the big question is, when you're found positive in India, what are you going to do with that knowledge? They all live in very populated apartments or shanties or on the street. So when you find that somebody's positive, normally what we would do is, if we were in China, we'd put them in a purpose-built holding site to keep them safe and away from their families. Or in Australia, most positives are kept on home detention, which can be very difficult even with an ensuite bathroom. But in India, it's really difficult. So I noticed Yvonne has raised her hand. So Rabbi, if there's a question from Yvonne, please let me know. So it is, and Karen has raised her hand as well, so I'm happy to take a question. And of course, as we go down this leaderboard, Russia is, I believe, underreporting, and the UK equally. It's not just a political thing, it's across the political divide of underreporting for many reasons, often because of lack of ability to test or lack of wishing to test, trying to conserve tests. So the UK at one stage stopped testing mild cases. So that 300,000 310,000 is possibly underestimated, given that they wavered, even contemplating the idea of herd immunity. And I think I would actually call even the consideration of herd immunity one of the wickedest ideas of the recent times, given the ignorance of those that wanted to even consider this, not delving into the past about what we know about immunity, which I will share with you in a moment. So I've gone to a report card on effort, and I've used that previous Worldometer looking at infections per million, because if you asked me to look at deaths, it's very difficult, because often countries have enormous death rates to begin with, because often they're elderly or severely ill will be the first cases, and the health system will be overrun. So it's often very difficult to use the death rate, and it's often not adjusted. So you don't just look at the number of deaths divided by the number of infections, because people have to have time to recover or die. So that needs to be adjusted, and it should be adjusted by age and severity. So I've listed Taiwan as the top of my leaderboard of have done well. Now, the pool boy, otherwise known as the husband, who helps a lot in, he thought he was retired, but he came out of retirement. He didn't realize this, February 11, when I was called to WHO to Geneva to have a meeting. And since then, he's been doing my daily graphs. So you'll see graphs by pool boy in a moment. And the pool boy thinks that I should call this the good, the bad, and the ugly. So I've just called it really well done, could have done better, and really you need to lift your game. Okay, so Taiwan, they have 19 infections per million. And one of the reasons that they were so fortunate is because, not through any luck, but through good planning. They'd had the experience of SARS, and they'd seen SARS and MERS in South Korea as well, and they shut their borders immediately. They found out China had some cases in January. So the WHO gets criticized from many fields, from left and right. The one criticism I have, and I've worked for WHO for a long time, and I, of course, think they do an absolutely splendid job. And most of the people working for WHO don't get paid. There are staffers who need to be paid, and there are people like myself who don't get paid. And so when WHO is criticized, what they are really criticizing is the country, the member countries who advise Dr. Tedros on how to go ahead with advice. So one criticism that I would have, that I think WHO may have done better, was getting people to close borders. And the reason they probably didn't want that to happen is because of many human rights implications. So the closing of the Taiwan border worked very well for them. China has 58 infections per million. I worked with the chief epidemiologist who's looking after Wuhan and other areas of China. And back in 2003, we evaluated the Beijing response to SARS, and we came up with the conclusion that Beijing should have been ring-fenced. In other words, they call it lockdown, but it's actually ring-fencing. So he ring-fenced Wuhan, Hubei immediately. And they've done very well. And many of the actions that China did have been described as draconian, but what people didn't realize outside of China was that it worked in SARS, and of course it works, and we're doing it now. So we need to be very careful about looking for blame and seeing how things are done differently in Asia as it being not done well. It is done particularly well. They've got an amazing amount of knowledge to share, And what surprises me is that post-SARS, no one invited any of the experts down to say, wow, how did you manage this? What will we do the next time around? And I think that we need to be thinking of an Western Pacific bubble for next time, so that like-type countries, Taiwan, China, Japan, Hong Kong, South Korea, and New Zealand can do this trade and infection control bubble because we're all trying to achieve the same thing.
Could
So
do you mind then just expanding, because two of the like amazing countries are Thailand and Vietnam, and
yes.
according to statistically speaking, so what have they done in particular that you would say should be part of the new regime, or perhaps even now regime, given what's going on still?
Mm. So the reason I didn't put those two is that I've worked in Vietnam. I really admire the epidemiologists there, but I'm not too sure that they haven't underreported given the problems of surveillance. And I understand their surveillance has limitations for many issues. But what they've done is mask use is one of the most obvious things, and plus China had a country border to prevent any cases leaking into those countries, and of course. Sadly, many Asian countries, the locals don't have enough money to travel between countries, so that reduces the risk of having cases imported as well. But that mask use has reduced the risk of transmission dramatically.
Thank you.
So the next group is Finland, and Finland initially toyed with the idea of the herd immunity, and then when it saw its epidemiological graph going skyrocketing, doubling nearly every 2 days, and not looking as if it was slowing down, they came to their senses and decided to put in the social distancing. The WHO call it physical distancing because they don't like the idea of the connotation of when you're physically distanced, you're socially distanced as well. And we're not today, are we? We are connected as a tribe together, speaking about this. So Finland has improved its potential disaster. Austria, Denmark, Germany, and Israel. Now, Israel was doing particularly well until they had a perfect storm of several things. And I work with Dr. Mitch Schwaber at WHO. He's one of the leading infectious diseases and epidemiologists in Israel. And he tells me on the ground what is happening there. And of course, summer, sweltering summer, very difficult to wear a mask. And the ministry and the defense are working together to make masks and make cloth masks, 3-layered, and giving them out to the communities. And of course, the Hasidim community initially found it very difficult to comply with that physical distancing. And then, of course, there's the really Lift Your Game group, Russia, UK, Belgium, Brazil, Sweden. Sweden, Rabbi Kamens knows that our daughter was in Sweden doing her master's. She finished writing up her thesis. Fortunately, she came home at the beginning of February because Sweden flirted with the idea and still flirts with the idea. Their chief epidemiologist has finally admitted that it wasn't working. So we could have been in the same area as Sweden had we done the same thing. And of course, their death rate is very unacceptable, in the thousands. So, the wickedness of herd immunity. The reason I just really dislike the idea of herd immunity is that, one, at the time we had no idea whether or not this disease would treat people exactly the same way. And of course it doesn't. We call it mild and severe or critical illness. That mild illness is a misnomer. It really suggests that you're not that your illness doesn't need a medical intervention, and yet people will tell you that they don't feel well. Even at 6 weeks, they still struggle to feel that they're getting life back to normal. This is a piece that I cut and pasted from Lin et al., who did a very lovely short analysis looking at SARS-CoV, which is the virus that caused SARS 2003. It's about 79.67% similar, so let's round it up to about 80% genetically similar to this particular virus that causes COVID-19, called SARS-CoV-2. And your long-term immune response, your antibodies, your immunoglobulins called IgG, and neutralizing antibodies peak at between 4 and 6 months to SARS 2003. It began to decline at 16 months, not rapidly, but by 4 years, 50 to 74% are hold those antibodies. This was not in a very large sample. And then there have been 1 or 2 other studies by Cow and others, and they found that by 3 years, the numbers went down considerably who held in immunity, or even talking about immunity is probably incorrect. It's holding, you've got your IgG antibodies, you've got antibodies that can help you fight this. But what we don't know, which is really important, is if you get a second round of a similar, 80% similar virus, it's an inflammatory disease. It's not a lung disease like it was with SARS, but it's inflammatory. And will you do worse the second time around? A bit like dengue. If you get dengue 1 or dengue 2, you can get what's called breakbone fever, and you hemorrhage. We don't know, and really, we don't really want to test this in humans yet. It's just unrealistic. You hear about people thinking they've had a second infection, but we don't know if that's true. We don't know if, in fact, they were one of those 4% that may have had their antibodies decline, but we think it's more likely to be a testing error. So while this little histogram suggests that it's okay for at least a couple of years, I believe that what we'll be seeing is a boomerang. The Northern Hemisphere will have a decline as summer months, and even that's not doing very well, because we do know that SARS-CoV, or SARS-CoV-1, really didn't like hot temperatures and very high humidity, at about 80% relative humidity. But of course, most Americans live in air conditioning, so it doesn't spread very well outside. But inside the office or inside any closed environment, that environment acts as a super spreading event. We don't talk about super spreading people anymore, because we realize it's not the people, it's the built environment that encourages the spread. So with 4% potentially losing their antibodies at a year, and perhaps 10% and so forth the following year, could be even more than that, but it could be as good as that. But do we really want to trial it? Do we really want to test it? So given our government in their sense decided that that was abhorrent, they tried to go for control. They have told us, looking at the economy, that they don't want to go for zero. As an epidemiologist, it's so much easier to control if you go for zero, because when you do have the occasional case coming up, it's only a small, little, tiny cluster as opposed to a big problem. Now, one of the things we do in outbreak during SARS, I have had students I've mentored through Ebola, is we don't just look at the numbers or the epidemiological graphs, but we look at what encourages super spreading events, and it's behavior. So I'm going to talk about behavior in a minute, and it's not good enough to get cranky at groups of people. It's up to authorities to plan it and know exactly what's going to happen, because we are a multicultural community. So rather than blaming particular communities, we should be planning for it. So New South Wales, this is the daily cases for the last 14 days. Now, the reason I use 14 days is because, as you can see, the daily numbers gives you an idea that in New South Wales, we seem to be having a controlled minor little bushfires around the place, but Victoria is going into what could be considered to be a major bushfire event. But it's when you look at a 14-day rolling average, not for each day over 14 days, but the average for the 14 days, that cumulative average. Because 14 days is just over double the incubation period, and WHO uses that to identify how well it's in control for perhaps lifting restrictions and calling off the end, saying, you know, we're at the end of the outbreak. So Victoria sadly has gone from single digits and then starting to ramp up severely. And what I find interesting about this is that if you've done any work in outbreaks before, you understand that you have to respond proactively, not reactively. And proactively is looking and being prepared to be criticized. So WHO was criticized severely and I think unreasonably when they got everybody on the high alert for the H1N1 flu. And they were doing that so that we didn't see this sort of thing, so we didn't see high death rates. And of course, when they're successful in getting everybody to plan and respond, and there's no death rates, people go, well, WHO's overreacted yet again. It's okay to overreact. It's okay to be criticized. Sure, the economy may shudder, but the whole world economy is shuddering and people are dying, as we've seen, not just thousands, not just tens of thousands, but we'll be having hundreds of thousands, a bit like a war. So this is a colleague of mine, and we co-supervise two students, Dr. Ori Gudis. And of course, Ori is Israeli, Australian, and part of our tribe. He has developed, he's a human geographer, and he has developed a beautiful GIS map. And this shows you where the hotspots are, where the infected hotspots are. And I've given you the address there so that you can go into it yourself and identify where your local government area is. He's also done it by local health district to find out if you're in a hotspot. So a couple of the hotspots were Waverley, of course, and that was tourism. Now, I was getting a bit anxious when we had closed the border, but we were cherry picking which countries we closed to, and then we were, knowing human nature and knowing outbreaks, we were not requiring people to go into mandatory quarantine that was supervised. And so that high number eventually caught the eye of the rest of the community and those in power, to then realize that they actually couldn't always rely on the best nature of people to stay under quarantine themselves. So they brought in a mandatory quarantine, which was a very good thing. But of course, we're a bit slow to agree to the way China did it, and they did it under supervision that you could not leave. And we could have reduced our numbers to maybe 1,000 in total had we followed some of the advice of China. Northern beaches where young people were coming back home and bringing it with them, and a few other hotspot areas there. This is his map, looking at it from a different perspective, and you can decide which perspective you find easier, and you can press on different areas where you live or where you have friends to see some of the hotspots. So why do we need hotspots? Because with epidemiology, we do ring fencing, and it's a little difficult in some of the areas where you can't necessarily see a very dense hotspot. That one under the local government area could spread across several postcodes, but you'll see in Melbourne it's so much easier to enforce hotspot ring fencing. I'll show you in just a moment. So I've been following, this is a graph by Poolboy, and he's kindly been doing these for me. And I think he did mention to somebody the other day that having your boss live with you 24/7, it's a bit like inviting your boss home for dinner and they never go. But he's very good-natured, and he's been providing this for me. And as you can see, Melbourne really could have been more proactive in getting more testing out. They were leading and have led in testing per 1,000 residents than any other state. So I do commend them for that. But people are wedded to the certain ideas when they haven't been experiencing many different outbreaks in many different countries, to understand it's better to be proactive and suffer criticism than having to be reactive. And I would have been putting in roadblocks, and because they knew what was happening, and I'll show you what was happening in a moment. And you can do it without blaming people, but you can also be putting in simple things like a mask use and a different approach to the hotspots, telling them they can't go out to except for to exercise. In other words, bringing in kind of home detention, light home detention, as we all had a couple of months ago. So this is the rolling cumulative one, and again, it's very easy. It's been smoothed out over 14 days, those 14-day rolling ones. Sadly, Victoria had been leading for quite some time. And Norman Swan, he's a lovely man, a nice, a great reporter and journalist, and he makes it look so simple, getting a message out there succinctly, but it's very difficult. I was interviewed by him, and it's very difficult, let me tell you, to be as professional as Norman Swan. And we were looking at this, and he asked me, but it didn't get up on television, what I thought was going on in Victoria. And I said, they have a super social interconnection. It was obvious to me from my experience, but also from looking at the graphs and the hotspots. And I'll show you in just a second. So this is the rolling day one. And, Rabbi, if you want to interrupt me with any questions that's posted, just let me know.
Go ahead and do this, and then, yeah, maybe it'll be
okay.
time to get
all right. So, Victoria. Now, remember I showed you a couple of slides back each day when the government was praising themselves about how clever they were, that each day they had very few cases. That's fine. But you also have to include the return travellers, because they pose a risk to those caring for them, the hotel staff, the hospitality staff. You have to add them as well, because we were certainly adding the residential aged care facility ones and the cruise ships. So when you add everybody, Victoria, sadly, represented as of the 27th, yesterday, 81% of all cases for that rolling 14-day average. So they have a problem. Houston, they have a problem. Now, I've been looking at the percentage increase, and it was steady and never going away. So this is where you need to be proactive and suck it up when people criticize you. So that proactiveness could have been happening, around 17, 18, 19 of June. Because we think the RO is 2.5, maybe 2.7, 2.8. In other words, every case can cause 2.5, 3 infections. Well, we know that that's in perfect conditions of a little bit of a social spread, but in a perfect storm, in weddings, religious meetings, dinner parties, etc., it can be 18, it can be 20, it can be enormous, and it can continue for a long time. So when you start to see, or when I start to see double numbers, I start to get very anxious. And when you go to triple numbers, if I had have had Mr. Andrews' phone number, I would have said, really, you've done such a great job. Now go further. Now really start doing some really uncomfortable measures. So, hotspots. I got this from The Age, and this was done yesterday, but even I knew where the hotspots were many weeks ago. And these are the hotspots in Melbourne at the moment. So as you can see, you can ring fence these. You can't see my little pointer, but I'm ring fencing Hume, I'm ring fencing Casey, etc. In other words, you do what China did. I know it's unpalatable, but it works brilliantly. You put up roadblocks, you bring in either the army or the police. At the moment, the police are not well loved by the community there, so you might bring in the army or even people who are ambulance officers or the firefighters who are very much loved and trusted. And you ring fence and you ask people in those hotspots, do not leave. There's one thing you have to do though. So working for WHO, they continue to harp on about the importance of ethics. And whatever you do, it has to be done ethically. So at the roadmap for COVID meeting on the 11th and 12th of February, we were asked whatever we come up with, it has to be ethical. So if we come up with ring fencing, we need to keep those inside the ring fenced areas safe, those that are not infected. The way to do that is ask them to stay at home whenever possible for 14 days for double the incubation period, and when they need to leave for exercise, mental health, and going to the chemist and to go for shopping, they need to wear a mask. We know masks work, and at WHO, we updated the mask guidelines and put them out on the 6th of June, and yet Australia is wedded to the idea that at the beginning of this pandemic, we said masks don't need to be used outside of high numbers of cases. Well, guess what, Melbourne? You've got a high number of cases in these hotspots. Wear a mask when you can't keep social distancing. And Marina and I were speaking just before you came on to listen, and we were both bemoaning the problems of people not keeping a social distancing because they're getting mixed messages from the authorities. The authorities are here to keep us safe, and we trust them. We're very trusting in Australia. We may be critical of governments, but we don't believe they're out to do us harm. And so when they say, look, the economy's hurting, we need to get back to something near norm, COVID norm, go about your business, but keep your social distancing, they're not hearing that last part. So they're hearing, my government cares for me, they're looking after me, they're doing the level best, but they're not hearing, I need to do something as well. And that is keeping my social distance, wearing a mask or a face shield if you can't suffer a mask, and hand hygiene as you're going into the shops to keep your germs from their high touch areas, hand hygiene on the way out, so showing respect that you're now leaving those germs behind. So I really believe that leaders don't lead by getting cranky. Parents get cranky. We are not led by parents. We're led by leaders that we elect and trust. And it's up to them to now be proactive and lead us. And how do we need to lead in those areas? We need to understand that we've embraced a multiculturalism in Australia. All of us on today in our synagogue come from a multicultural background, and some of our names belie that, but we all do. And when our parents and grandparents and great-grandparents came out to this country, I know that my great-grandmother couldn't speak English. And we need to take this into account because it still occurs. So let's play the blame game not. So we need to understand that Victoria is very complicated. So this is a social network analysis that the lovely Dr. Karen Feil and myself did with Thomas Valentine from California. He's an expert in social network analysis. Karen had been living and working in Vanuatu, and we were trying to understand how to keep children under the age of 2 safe from diarrheal disease and associated death. And we realized that we needed to speak to the person that has the most influence in their tribe, in their village, in their urban areas. And so we did what's called social network analysis, where we asked simply, who do you speak to? Who do you listen to? Who do you talk to about health issue? Now, we were expecting the young mothers to tell us that they listen to older mothers or their mothers. But interestingly, they didn't. But that's beside the point. The point here is that this woman here was the go-to woman. And as you can see, looking down at the dark green areas, each one of those has a go-to person, and that could be an extended family. Up here in the light blue, also. So, you don't have to have a Nobel Prize in understanding outbreak management because it's all about managing connectivity. So let's have a look at how this works in Victoria. So I placed the clusters in Victoria into 3 main areas. That 4th one in grey is a very large number under investigation because the ministry is doing their level best to try to find out how these people acquired it, and it's not unknown, they just haven't been assigned yet. But of those that have been assigned, and that 13% for quarantine is probably higher if I were to remove 154 from the denominator. But nevertheless, 13% of cases are related to the travellers that came back, and that 17 have been infected in the last 14 days, but many more previously to history of previous 14-day rolling average. The staff and their family have acquired this from the travellers because sadly quarantine hotels are not purpose-built. Now, what is the difference between the quarantine hotels that are not purpose-built in Sydney versus Melbourne? Well, it's social network analysis, which I'll show you in just a moment. The community, there's large clusters of families. There are 3. They call it the Walter, the Coburg, and the Keloy Downs. 3 large family clusters. There's shops and other, and that's 7 others. Now, the shops are also interconnected as well. And then there's the providers, a GP. Now, that GP had connection with the family clusters, a family cluster, and sadly worked across 3 practices without a mask. And then there's the dental, rehab, and residential aged care facility. So that GP had a connection with one of the families, I believe it was the Keloy Downs. Then So that 56 was across three large family groups, but so was the shops. The H&M shop, they believe, and McDonald's also were related to one of those family clusters. And then, of course, there's the Keillor Downs family in the staff, in one of the security staff. And so security staff and their families. So which way did it go? Did they catch it from the travellers, or did they get it from the large family clusters? That will be worked out later with some further epidemiology. But there's a further 9 other staff from previous days. So all of this is highly interconnected socially from this community large family cluster. So why I don't believe that we should be doing the blame game with the Muslim community is because we could do the blame game of our own leadership. So we know that January 11, the public health emergency of international concern was announced by WHO. That is far more important than March 11 WHO announcement of the pandemic. When the WHO announces a FEAC, that public health emergency of international concern, legally the members are obliged to start responding. So back in January 11, part of the response is training, getting hospitals ready, working out how many masks and gloves we have, extending, maybe we need further beds, and how to educate people for what we call super spreading events, such as residential aged care facilities, managing all the aeroplanes coming in, and managing our multicultural society. So we also knew, you have to be in a coma not to know, that January 25 is Lunar New Year. Now around January, the Chinese, Australians, Chinese from China, Chinese from everywhere, travel to meet their friends and family. It's a very joyous occasion. So when we closed our border to China, we failed to close our border to America, to the UK, to Europe, and we had an enormous influx. So when on the 27th, our government announced that we had a likely pandemic in Australia, that was a fabulous understatement. We already had 3,000 cases. So really we should have been locking our border not just to China but to everybody, and that included the Italian Grand Prix men and women. So blame, we could have done better ourselves. We could have done better with full border protection, mandatory quarantine. We would have saved hundreds. Hotel quarantine, educating. Hotel staff are not the same as hospital staff. Our hospital environmental cleaning staff and security are trained very, very well. And it's not good enough to be able to say to the quarantine hotel staff, this is how you use a mask. Even nurses and doctors get mask taking on and off incorrect. They make a mistake. They make a mistake with cleaning. Otherwise, we wouldn't be getting any hospital-acquired infections and any transmission of COVID between staff in Australia and also the rest of the world. And we wouldn't have the GP working across 3 practices spreading it. So we make mistakes. The cruise ships are just like flying aeroplanes. They're on water. They pose exactly the same risk. And the residential aged care facility is not purpose-built, same risk. So we've made mistakes. So we had plenty of time to embrace our multicultural community with English as an additional language. And sometimes they can't read their own language as well, or they can't get access to their own language. So Eid. We celebrate the joy of Eid with our Muslim cousins, and we know that it occurs this year on the 23rd and 24th of May. So there needed to be the imams and the general social community to come together to say, sadly, this year you cannot have your extended breaking of the fast on the 23rd and 24th. It has to be different. And I'm not into blaming our multicultural community, because when we embrace them, we don't say, can you read your own language and can you read English? We embrace them because we know the next generation and the next generation they can, because certainly my grandparents and great-grandparents couldn't. So then there's the blame of, I think I've got a few more minutes, of the Black Lives Matters and the Hong Kong protest. So if you notice, Hong Kong protests, 100% of them are wearing masks. And when I looked at whether or not that rally or protest caused a spike, I could only find 4 additional cases. On June 10 was a protest. 14 days later, they had certainly 10 cases, somewhere between the ages of 0 and 78 years of age. But most of that was clustered around an aged care facility living arrangements. So those masks were highly effective, and certainly keeping their voice quiet does not push particles through the mask. We have 2 Melbourne cases that attended the Black Lives Matters, but we don't know if those 2 cases either spread it or acquired it. And certainly we don't seem to have further cases yet. And as you can notice, not all of them were wearing a mask, but I believe that you have to look after the hearts and minds of people, not just the numbers. And this was a touch point. This was like enough is enough. When we saw that 16-year-old Indigenous youth slammed to the ground, that could have been my son. He was always chatting like most good Jews. We do like to argue, and that could have been any of our young boys. And the young people were incensed about this. So we could have provided them with important infection prevention instructions to ensure that they didn't spread it or acquire it, rather than being parental and saying just no. So yes, I think it's important for everyone to get behind not having Eid dinners, not coming together on Shabbat for large extended families. But equally, there are other important public health issues going on that have gone on for 250 years. And how do we best deal with it without feeling that we're pushing it under the rug again? So, Rabbi, I'll leave it at that. I've got the last slide is just basically addresses, website addresses for the community to go in and search themselves and have fun with, not fun with flags like the Big Bang, but fun with graphs. And I'm happy to take questions.
Okay, I'm going to start off with a few, because thank you again, and so thorough, detailed, and I guess in a sense sobering, because a month ago, as I said at the beginning of the hour, when we were hoping to do this, we were talking more about balancing the risks with the fullness of living, but it seems like, unfortunately, the risks have not dissipated greatly. In terms of doing some proactive relief, I think a lot of us here in New South Wales, where we don't quite have it under control, are looking enviously at those states that shut down, like Queensland and Western Australia, Tasmania, South Australia. They have hardly any cases even over a 14-day rolling. Is this the time for New South Wales to thoroughly seal its border with Victoria? Is that the kind of proactive,
Yes,
stuff you?
yes. Look, the closing borders was a good idea at the beginning, because we believed that we had a homogeneous risk across each state. And so we put up state borders with everybody locked down. Now that we have hardly any cases in any other states other than New South Wales and Queensland. I think the time
New
is
South
too.
Wales and Victoria.
Sorry?
You mean New South Wales and
New
Victoria?
South Wales and Victoria, sorry. I think that we now need to release Victoria except for the hotspots. They are very much family related. Some of the numbers, some of the cases are going into the schools, but they're not spreading within the schools. They are still related to the families. And of course, the hotel quarantine is related to families and the risk that the hotel staff have while caring for the travellers. So I think that testing the travellers before they come in, before they leave, is a very good policy. I don't understand why people are not accepting that, because it's their social responsibility. But I think we can relieve the full border and just have ring fencing around those hotspots.
Okay, thank you. And similarly, someone asked a question in terms of spreading events. You're still confident that schools are not places of super spreading? I know that children all sit together in class. They're not doing social distancing at schools per se and things like that.
Yeah, the epidemiology in Australia still says that children are safe. They can get COVID-19, but the cases, the majority of cases in Australia have been from their families or extended families. Children have a different immune response, and they have an upper airway immune response that works rapidly, but they need constant exposure, and that happens at home rather than at school.
Okay. And the thing that you mentioned, someone, I'll just follow up a school question and then I'll come back to 40 school kids pile on a bus I was on last Friday. This is an adult writing of you. What is the risk to the 11 adults socially distanced up until that moment, and what does it change when those 40 kids get up?
There is a risk to the staff, and the staff have
No,
had
this is for
good.
people on a public.
On a public bus. We do know that somebody coughing 2 meters away, you are at the same risk as somebody speaking to you for half an hour 2 meters away. We do know that in that environment, it's a potential super spreading event. If any of those children were coughing, speaking loudly, they are at risk. And this is why WHO has pushed out an updated guideline to say in public transport, because I was actually part of that committee and I was pushing for mask use in public transport, that in public transport, please wear a mask. Because you could have a long bus trip. A child may be laughing, and you can't turn around and glare at this poor child and say, don't talk, because we don't have a statewide or a national approach that says, you're in a queue, you're in public transport, don't speak. You're in what we called super spreading, amplifying environment, don't speak. We haven't done that. So don't be the germ police, just put on your mask.
And I remember that was so that's a good segue to the mask question, because I remember earlier conversations and there wasn't the advice necessarily to be putting on masks. And I remember that there were two aspects or many aspects, but one is, of course, the mask is primarily to prevent you, a potential carrier of the virus, from spreading it to someone else. They're not quite as effective from protecting you from acquiring it, I gather. So I'd like you to speak about that.
So this is where our leaders need to get with WHO and the new evidence. We took about a month and a half to get all of the new evidence together. We did a meta-analysis. Well, I didn't do that. We hired and tasked people from America to do what's called a meta-analysis and look at the new evidence for mask use. And this idea, and it constantly is spread as an urban myth, the mask won't protect you. It only protects those from you if you're infected. That is not true. So if we have a look at in the hospital system, environment, people wear a mask to protect the patient, but to also protect themselves from the patient. It works both ways, a medical mask. And now, with better cloth masks, they also work both ways. So the idea that it only works for a person with the infection is not true. Otherwise, you wouldn't have people wearing a mask going into a ward with people who are infected with COVID.
Okay, but now there's the question of what kind of, I remember also though,
What kind of mask?
what kind of
Okay.
mask, because we weren't wanting to get the masks that the healthcare workers needed. They were short supply, So.
Absolutely, correct. So we didn't want to use all of the good medical masks, and we still don't. But there's much better evidence that new cloth masks can give you up to 70% protection. And I bought my son a new, very sexy black cloth mask that gives 70% protection. He's living in one of the hotspots of Melbourne. Also the Korean N95s. Now, you don't need an N95 mask normally, but they're more comfortable than the surgical or medical masks. You know, the ones that actually, I've got one here. Sorry. Okay, so this one here is a medical surgical mask. It's got a piece of metal in here that goes on your nose, and you press it and then you put it behind your ears.
And then your glasses all get steamed up and everything.
Yeah. Now, the problem is these are horrible to wear. You steam up your glasses, it's horrible. This one is supposedly an N95 from Korea. You have to, actually, I cut it up. I was doing science to see what it was made from. So this is the way up. And it's more comfortable than this one because it's slightly away from your face, so you're not building up this humidity. Either of these don't work once they're moist because it affects the filtration layer in the middle. This is supposed to be water repellent, but it's the point on the other side it gets heated and doesn't work. So the cloth mask we now know, the better cloth mask. So that idea of it not protecting people previously was based on old cloth masks, but the new ones, modern ones, are so much better. And you wash them in soap and water just by hand and hang them up.
So the N95, for example, you'd wear it, it would probably get moist within a half hour, I would figure. I know and then it's
Correct.
no good after, and so then you need a new one each time.
Yeah, exactly.
Whereas the cloth mask, you could get a couple of them and just rinse them. And would you recommend, okay, so we're coming into this new area, and would you start, here we are, in, I think probably most of us in the Sydney area, would you recommend that we be wearing masks every time we go out to the grocery store or in public, and or just at specific times?
Yeah, no, just in specific times where you can't keep your social distancing, in public transport, on an aeroplane. Now, can I just talk about airplanes for a second? So people talk about...
You think they're really going to fly again?
Well, around the country.
Yeah, okay.
Yeah, I was supposed to be in Turkey and visiting my daughter on a kibbutz right now, but I'm not, and I won't be for a couple of years. Yeah. So, on an aeroplane, they say they have a HEPA filter. Now, when I heard that, I giggled because a HEPA filter doesn't work like magic. It doesn't work like UV raining down and killing the virus. It's got to be sucked into it to filter it to then push it out. And when you're on a ward and you're standing in an infectious disease ward, such as a COVID ward, they'll have a HEPA filter, but they'll also have negative air pressure so that any air that's filtered won't rush out and go into the ward. But also, that HEPA filter keeps people on the outside of the ward free from getting contaminated. So you're in a plane, the person next to you is coughing, the person 2 meters away is talking, you're going past people, you're talking to your cabin staff, and they could be 2 days before they get a symptom, they don't feel symptomatic, and they could be shedding the virus and pushing it out. So that HEPA filter is not saving you. So please wear a mask or a face shield. So as I said, masks are not charming, they're not pleasant, but a face shield looks a bit daggy. But if it comes down to here and around here, it is better. People can see your mouth going, and it's not hot. So it needs to be the new norm. But
That's great.
people don't like it.
There's some shoppers among us, and two questions are: where I've seen those face shields. You can get them kind of anywhere, or
Yes.
And the other one is people are asking those cloth masks. Where do you recommend? Is there one you recommend, or a few that you could guide us to get?
Yeah. So the ones that I've seen, and I've asked
Like you
people
got
how
for
they.
Zach.
Yeah, the one I got for Zach, I got in a large chain, pharmaceutical chain, pharmacy chain, and they're about $39 or something, and they're reusable and reusable and reusable. So it's fairly cost effective. A half a dozen of these is about the same price of one cloth mask. So that's a black cloth mask. You'll see it in a box. Sadly, it's downstairs because I haven't sent it to him yet, but I can't rush down and show you. But it has the photo on the outside, and it looks just like the photos that you see in Hong Kong with
Right.
the protesters.
Okay, thank you.
So back to your question: do you want to wear it when you go shopping? Look, if you're over 65. You're overrepresented in the death rate and in the severe COVID. If you're over 65, if you've got an immunosuppressed issue like diabetes, cancer, etc., if you've got somebody at home who has, wear a mask when you go out shopping. But please wear a mask in public transport.
Okay. Thank you. And so here we're talking about coming back into living. So we're doing that. The schools are opening. People are going back to work somewhat, using public transport, a caution. Obviously, if you're in a crowded place, a caution. So the pub's open across the street. What's your advice on my going over and having, going back into these places voluntarily? And here you were torn between being an epidemiologist and of course being a loyal Australian wanting to see the economy growing. So what's the balance there?
Yeah. Are you standing outside in that pub? Are you outside in the sunshine?
It's like most, yeah, some of them you can stand outside. No, this is basically an indoor pub.
All right. So stand outside. Now, being a man, you probably don't. I was going to say you probably don't talk a lot, but Rabbi,
Don't
you're
stop
a
talking.
rabbi and a Jew, so I think, I think like the rest of us, we talk a lot. So 2 meters apart for half an hour talking can be just as risky as somebody coughing from a distance. If you know them, then enjoy their company. Try to keep your distance. If you think you're at 1.5 meters, step back one more, and then you'll probably be at about 1.5 meters. You're outside. It's not a super spreading environment, so you're at less risk. But you know who the people are, so that if something untoward happens in Sydney, you can then call up your friends and tell them that you've been unwell until you get your test results. But going inside, I prefer you don't.
Yeah, thank you. It's such an interesting thing. So the full, the other thing in terms of this fullness of living is people are going back to each other's homes for Shabbat dinners, the occasional meal. Again, even though there's very, quote, few cases, unquote, in New South Wales, you think the risk levels are somewhat concerning, that we shouldn't be doing too much of that.
Well, in the eastern suburbs, you're highly connected, and if you're going to have Shabbat dinner, try to keep it to your family and one other. And look, what has happened in the Muslim community could be us. We're highly connected. We're very sociable on Friday nights and Saturday. It's just who we are. And so we have to be careful. So if our numbers start to increase, we need to back right back. And our numbers so far have been very good, but that's 6. Now we know that 100% of cases are asymptomatic until about day 5. 100% of us, and yet we're very infectious 2 days before we get those symptoms. So if you do go to somebody's place, No hugging, sadly. No crowding around the kitchen trying to assist. Stand back, sit down. Sadly, no raucous laughing because that just pushes the particles out. But just keep a diary of who you've had Shabbat with, and so that you can help the authorities if, God forbid, anything should happen.
Yeah, so here we are. You mentioned Eid in the Muslim community. It's less now than 3 months to Rosh Hashanah. We as a team are trying to work out what to do now. Right now, as of this upcoming weekend, we can open the synagogue a lot more, to as many as we can fit with 4 square meters. Now, I also sit in these multicultural conversations. I know there's pressure, from also the restaurant industry to get rid of this 4 square meters, and to just have people social distance. So first of all, do you see advice coming to get rid of the 4 square meters and only social distance? And would you see that as leading to more risk? The reason I bring that up, Rosh
Yes.
Hashanah Yom Kippur, is with the 4 square meters rule, we can fit about 200 people in the building. Without the 4 square meters, we could probably fit 500-600. It really changes, because you could still do social distancing. And all of a sudden, that's a lot more people in a closed
Absolutely.
space. So what are your thoughts on
Absolutely.
that?
I believe that our government has explained to us, our federal government, that they're not going for zero. So when they start lifting restrictions, we're going to have to cope with increased numbers. So Rosh Hashanah, yes, we may not have the 4 square meters, we'll have more people in. We need to register when we're coming in so that we've been in there, so you can contact all of us. And it will happen. We will be all together and we'll be trying to socially distance. People will be busy chatting to their kids as they're going in and out. They'll be forgetting about social distancing. We need to accept the new social norm of just giving people plenty of space, but we'll forget. So I hope we don't have any cases in our community, and that we're a little careful. I'd love a new social norm of wearing a face shield. But that and like the masks has been very much socially unacceptable, which in Korea all the little kids wear a hat with a face shield. Now we could adopt those hats, then wouldn't matter.
Yeah.
We'd be all there singing away.
Because this is going to be the interest, the question of singing. I mean, right now, you would maintain your advice that we shouldn't have choral music?
Sadly, yes.
Yeah.
There's been 2 outbreaks in choirs in America.
Yeah.
And one of them, one of the biggest one, in what we call the index case, that source case, attended and believed that he wasn't infectious. He didn't feel he had signs and symptoms. And as I mentioned, 2 days before, you can still spread it before you get your signs and symptoms. And that caused over 50 additional cases.
Yeah. Amazing, amazing. So here, do you think, coming back then to the synagogue, do we require, because up until now, we haven't required people to wear a mask to come to the synagogue.
Mm-hmm.
First of all, the numbers have been relatively small, but we are starting to come back. Should that be a prerequisite of entry or highly encouraged, or we are registration, temperature taking, that's going on.
Yeah, so taking temperature sends a visual public health, I'm taking this seriously. Sadly, only about less than 1% of all cases were found doing population screening in Iceland and in the homeless in the US. So temperatures in patients, yes, elderly patients usually get a temperature, which was the complete opposite to SARS. Elderly didn't elicit a temperature. The elderly elicit all of this horrible immune response, but the rest of us, very few do. But nevertheless, it sends a very strong message. We're taking this seriously. But I would strongly recommend people wear a mask. Now, kids find it very difficult, but if we adults are wearing them, then we should be okay.
Okay, and now people are out there starting to do multi-generational living. Is this putting grandparents at risk as they get more involved with their grandkids back at school and things like that?
Wow, I think that's one of the most difficult questions you've asked me. So, Asia has said that, and other countries, Muslim countries have said they haven't had a problem losing so many elderly because they have their elderly at home and not in residential aged care facilities. So if they're not living in residential aged care facilities, they're at less risk if they're living at home. But if we're having intergenerational connectivity again, it does increase their risk. Because they do get sick rapidly. But we also need to look after their mental health. The older generation and the younger generation, in fact, all of us love to see the grandparents being involved. So I think that has to be balanced. And families who don't have a lot of interconnectivity outside other families that are still working at home, they're at very little risk. So I think that people can balance what's their connectivity outside the home and what is their risk to the grandparents.
Okay.
Because
Right.
don't forget, kids won't be bringing it home from school. I shouldn't say won't, is highly unlikely to bring it from school to home. They may have picked it up from an extended family, more likely than at school.
Right. So a lot of it does come down to this connectivity. Was that the pool man?
That's the pool man. Come and say hello.
Let's say hello to the crowd.
Come and say hello to the congregation.
Come say hello.
You'll have to bend down.
To the whole congregation.
Absolutely, the whole congregation.
I'd just like you all to know that I'm the person who's responsible for the graphing.
Yeah, that's why I wanted to have you come over here, because you
can't hear.
Hang on a second. This one here.
Yeah. I was saying that's why I wanted to invite you, everybody, because she's already told us how much the pool man is responsible for all the graphs.
That's good.
I gave full honor. Kol hakavod.
We
need to go for coffee.
Okay, good.
In a moment, you guys know.
So, and then comes the heartbreaking question that so many of us have, and you alluded to not getting to see Zia, for some time now. International travel, do you think it will begin sometime with strict requirements of mask wearing and mandatory quarantine, et cetera?
Yeah, look, I think life's not going to be normal for a long time, and it's really hard to cope with this idea of us not going overseas and seeing our families. So we're going to have to cope with, if we want to go overseas, we're going to have to come back to quarantine, and that we might have to pay for that quarantine ourselves in a hotel. Or I'm hoping that the government will start to build purpose-built quarantine facilities that keep the staff safe, but that's probably for the next outbreak, and there will be other outbreaks in our lifetime, but they could be used for other things outside of the outbreaks when everything's calm. We're also going to, if we are going to lift the borders, please wear a mask when you're hopping on that aeroplane. It's going to be horrible, so maybe wear a face shield, because if you're sitting in an aeroplane for 20 hours to get overseas, a mask is going to be fairly unbearable. So think about switching between a mask and a face shield. And when you get to your destination, decide, well, what is the prevalence of the infection at your destination. Serovax Biotech from China and the University of Oxford are both testing vaccines, about a total of 9,000 Brazilians. That's going to be starting next month. And I'm keeping my fingers crossed. There are 192 other candidates for vaccines. we're not going to be safe until we find a vaccine. And as you've seen from those immune response graph, maybe those who've had it may be safe for a year or two at the most. But for the rest of us, you really don't want to have this virus. It's not nice even as a mild case, so supposed mild case. So please, when you get there, when you travel overseas or you travel interstate, wear that face shield or mask. Make it the new social norm.
Wow, amazing. Okay, it's going to be new rabbinic. Where you talk about people having to lead. You've just told me I have some new fashion gear to go out and get later today.
Sorry.
That's okay. And you got to do the right thing. And then the question is related to this. You mentioned the vaccine, but it's everybody. So, what was it that finally led the Spanish flu to dissipate and not come back?
Yeah. Okay, so the Spanish flu had the war going on. So during that war effort, and of course it was called the Spanish flu because the Spanish journalists could write about it, but everybody else couldn't. So it actually occurred in America. Then the young soldiers were pushing it out into the battlefields, and then it started to decline. And then, of course, when they were trying to have another war effort of support, a ship came back from England with a slightly different strain. It became worse. And then, of course, they had ticket parades to try to get people to support the war effort still. And so it took off again. And what eventually caused it to decline is basically that the war stopped. People stopped communicating between countries, and it caused it caused a herd immunity, certainly. And in fact, the elderly during H1N1 fared better than the rest of us because they had some of that antigen of that unusual flu during H1N1. It protected them slightly. So yes, it was a slight herd immunity. And also flu had a much shorter incubation period. So there are many different things. There was, it had a slightly different RO, so it didn't cause as many infections, except for when you're in that super spreading event of on a ship going to the war effort, in barracks, and then coming back and having, the parades. And some states in America refused to have ticker-tape parades, and they did better than others. And then there was a shorter incubation period and a shorter infection period so that you recovered better and faster. This one, it takes many, many weeks, and we're not sure how long you're infectious for, and we think you're infectious for longer. So there was behavior and the dynamics of the virus. Those two play a part, and at the moment, this virus is very dissimilar to flu.
Right. So so a couple of final things. One mundane, but the comment about shields has raised a lot of questions. So the pharmaceutical store for the mask, the cloth mask that you recommended, and the shields. Where do you get and some of the best brands of them? Are they're all the muchness?
Yeah. So the face shields, you can get them in the hardware shop, but they're very heavy. And they're really for, welders and people scraping paint off, etc. But they're very heavy, and particularly heavy on the back of your neck for women and for elderly people. The better ones are the they call them singular use in hospitals, and they're very light with a padding around here. Now, I don't think you can get them outside of hospitals, so we really need to agitate the shops, particularly the hardware shops and the chemist, and say, can you bring in some face shields? Because the more we ask for them, then they'll start responding, just like they did to masks.
Okay. Hear that, wise entrepreneur out there? You got a mask business going somewhere, and maybe we can do a deal at the synagogue to help market those. Now, so we began with the the balancing of the risks with the fullness of life. Unfortunately, it seems like that we are still having a fair amount of risk to balance right now. Given that, what is the fullness of life that we can safely experience? What are those things that you would advocate for the physical, mental well-being of everyone listening to that?
Yeah, look, it's really important to be with your community like you are now. Go to the synagogue, wear a mask or a face shield, and embrace the community. Go out and to have coffee, go for walks, try to work from home, just by just doing a few things to reduce risk. Don't go to areas where there are large crowds, but see your friends, because you are allowed to. The numbers are small in Sydney and in New South Wales. Just if you've got friends and family in Melbourne, tell them to wear a mask on public transport, enjoy their friends, but at small numbers. If they need to go to shopping malls, no one keeps social distancing at shopping malls. Wear a mask. I know it's outside of what our authorities are saying, but our authorities have done a great job. They've done a few shudders where they've got it wrong, but I believe that they've got it wrong when it comes to mask use, when we need to get you out, spend some money, have some fun, but don't put yourself at risk. And in Sydney, you should be A-OK so far. And when it comes to Rosh Hashanah, go to the synagogue, wear a mask, and enjoy the community.
Go to the synagogue if you can, because we will have to be restricting numbers no matter what.
Yeah.
So people do have to pre-register, and we still haven't figured out how we're going to organize the limited numbers. But obviously, yes, we can connect in community this way. I'll just give a few plugs for things coming up. Speaking of connecting the community this way, this evening, Rabbi Jacqueline Nino is in conversation with the Farkash sisters. Ruth and Leora grew up in Jerusalem in the late 40s, witnessed some of the most pivotal moments in the history of the city of Jerusalem and Israel as a young nation. So they remembered all the bombardments, etc. And years later, they made a journey. Parents read documentation, piecing together fragments of their personal story. And so it is a special conversation with them about their documentary Gathering Fragments that you can click on our website to be able to watch before tonight's exciting program at 5. Afterwards at 7, in conjunction with the New South Wales Jewish Board of Deputies and Rabbi Gad Krebs at Kehilat Matzada, whose idea this was, Peacemakers, a series of Sunday evenings, just for an hour, talking to on the grounds Palestinians and Israelis working together for peace. Tonight, Echo Peace, a fabulous organization trying to bring clean water to all the inhabitants of the land, as well as other environmental programs. And you know that we began with acknowledgement of the Gadigal clan of the Eora nation, on whose land we now speak from and where our synagogue is. We will be speaking with Aboriginal leader and lawyer Tila Reid, who was at the Uluru Statement of the Heart, from the Heart Convention, along with Thomas Nayor and Justice Stephen Rothman, who, like many of us, did not know much about Indigenous issues growing up, but has become a passionate advocate for them, enshrining a powerful First Nations voice in the Constitution, the urgency of structural change in Australia to honor First Nations sovereignty. The time to act is now. The time to, click in will be a week from now at 5 o'clock. I want to thank Marina for bringing these activities together. She does a fabulous job. She and Mary Lou have been planning today. And I want to thank Rob for getting the news out there. And Mary Lou, I want to thank you again. So generous, so deep, so detailed. I imagine there may be some requests for the PowerPoint. It's up to you if you'd want to share them so people can really follow all those links and become aware. But You know, I look forward to having you back when we can say the worst is behind us, but I don't think we're quite there yet. So we will be well, we will be careful. Thank you for the updated advice on masks and shields, and for coming together into community, but smiling more than singing. Have a wonderful week, one and all. Shavua Tov. Thank you, everybody, for coming together this morning.
Today, Rabbi. Keep well.
Thanks, Meredith.